Okay. Knock, knock. Can I come in?
Hello.
Can I come in?
Come on in.
Hi, my name is Kate. I'm a student at Cedar Crest College. I'm going to be teaching you about some new medication today. Can I have your name and date of birth, please?
Joanne Arthur, March 1st, 1966.
Alrighty, I'm just going to double check your badge there. Alrighty, Mrs. Arthur. I'm going to teach you about some new medication. We're just going to close the door here. So I understand you've been having some issues with rheumatoid arthritis and having a flare-up of that in your hands.
Yes.
And then I also understand that you were having some issues taking your medication that has kind of led to a diagnosis of deep vein thrombosis.
Yes. My car broke down. I couldn't get to it for a while. Couldn't pick it up.
Well, today we're going to teach you about the two new medications we have for you. We have Heparin and Prednisone. First thing I'm going to do is I'm going to go over that list of medication you're currently taking, and then I just need you to confirm that you're taking them, okay?
Okay.
So we have Coumadin, 5 milligrams daily for your AFib, your atrial fibrillation. Your aspirin, 81 milligrams daily for pain. Your methotrexate, 25 milligrams orally weekly for that rheumatoid arthritis. Folic acid, 5 milligrams orally once a week. And the multivitamin that you take once a day. Does that sound correct?
Yes.
Okay. So before we get started on your prednisone and your heparin, I'm going to go over some quick nursing diagnoses, okay?
Yes.
So first we have coping, readiness for enhanced, related to new medication prescriptions as manifested by not wanting to return to the ED again. And 3 short-term goals I have for you by the end of our session today is verbally acknowledging that you understand the new medications that you're taking of heparin and prednisone. By the end of today, we're going to show you that you can successfully self-administer the heparin that I'm going to show you how to take. And then we're even going to help you set up on your way out a way to deliver the medications to your house so you don't have to run to the pharmacy all the time. And the long-term goal we have for you is a increased dexterity in your hands from the rheumatoid arthritis and a decrease in the leg pain you've been having from the deep vein thrombosis. And the next one I have is pain syndrome chronic related to not taking medication as manifested by severe rheumatoid arthritis flare-up in your hands. And at the end of today's session, we're going to have you be more educated on the importance of taking the prescription medication as prescribed by your provider and being more informed of the medication organizers and other utensils that we have for remembering to take your medication, as well as the making it easier to open up those medications. And we're gonna have you understand the schedule for the prednisone. We'll go over it's a tapering system. So with your long-term goal, we have by your 2-month checkup, we'd like you to report your pain at a lower level. And the last one I have for you is health management ineffective related to lack of blood work done for the Coumadin as manifested by the INR lab value of 1.1. So your INR levels should be at a 2 to 3, so you are currently at a 1.1, so we're going to want you to increase that level. At the end of today's session, we're going to have you have some more education on the importance of following up that medication information. We're going to have you be able to pre-schedule that blood work for your doctor. We can do that at the counter on the way out. And we're going to have you show that you can self-administer heparin on your own. And you're also, at the long-term goal we have for you in the next 2 to 3 weeks, is to have that INR level between 2 and 3. Do you feel ready to learn about your heparin?
Sure.
Okay, so we're quickly going to show you a couple things on those utensils I told you about. So we have an Aleve bottle here that has a wider cap and it has a rubber grip on it. It makes it easier to open it up. We also have here a rubber gripper to use for other types of bottles to make that a little bit easier. Now I have a calendar as well. So when you check off each dosage of the heparin you take, you can just check it off on your calendar. And right next to that calendar, you can even put this prednisone checklist. So the prednisone checklist is you take your prednisone every single day, but it's on a tapering system. So first they're going to have you take it at 80 milligrams for 5 days. And you can just check off each dose After that, you're gonna go to 60, 40, and 20. You're gonna need to do each of those for 4 days. And then the last one is 10 milligrams. You're only gonna take that for 2 days. So we're going to decrease it because it is a steroid. And one last thing is people with rheumatoid arthritis often talk about how the cold makes your flare-ups worse. So wearing long sleeves or like gloves can help. A lot of the patients say like a sock on the arms or like fingerless gloves can really help decrease that pain. So with prednisone, the most common things are nausea, vomiting, diarrhea. You're gonna find those maybe some GI upset. So the best thing you're gonna wanna do is take that in the morning with your food. So you can take it in the morning with your food and just check it right off. So the next thing we're gonna do is talk about heparin. Do you have any questions about prednisone?
No, I've taken it in the past.
Okay. So the most important thing is that checklist because a lot of people have issues with remembering those dosages. So next thing we're going to teach about heparin. Another name for heparin is also called Heplock, where prednisone is typically just called prednisone. So that's pretty easy to remember. So heparin is an anticoagulant drug, so it helps decrease those blood clots from forming as well as break up some of the blood clots that you already have. Some of the most common things are rash, pain at the injection site, a fever. The most important things you want to remember this is use a softer toothbrush or an electric razor to prevent bleeding. And if you have any signs or symptoms of unusual bruising or bleeding, you're going to want to call your provider immediately, okay?
Okay.
So with this medication, you're going to be taking it 3 times a day, subcutaneously injection. Now, the medication can be taken in more of the fattier areas of the body. Typically, it's taken in the abdomen about 2 to 3 inches, about 1 to 2 inches more so, away from the belly button. That's the most important part. So you're going to rotate the sites. Or you can take it in the outer thigh or the upper back, but those are less common areas that people take them. So now I'm going to show you how to do that. So the first thing we're going to do is use sanitizer. And then, yep, if you just want to put on your gloves at the same time as me. So use sanitizer and put on the gloves. And these will all be provided with your kit as well. So we're going to take an alcohol prep pad and we're going to clean off the site of your heparin. Then we're going to draw up to the 1 milliliter line. This helps get some air into it. We're going to inject it down and push the air into it. We're going to invert it and go up to that 1 milliliter line. Now, sometimes if you go a little back, you can push up, get any bubbles out, invert it. We're going to recap. We're going to take another one and we're going to wipe the site. You don't want to put any germs in your body. Now we're going to pinch the skin, go in at a 45-degree angle and just push in and release that, and then recap this and put it into a sharps container. Now, are you able to teach me back what I just taught you?
Sure.
Okay.
Clean, and then I would clean my site. So
yeah.
This is you said a fatty part.
Yep.
Okay, that's clean. And then I'm going to uncap. We're going to get the air out, invert, go to the number 1 on here, take it out, and then you said I go pinch my area I'm going to put it in, and then I'm going to go on a 45-degree angle and just go in like that. And as soon as I'm done, I need to recap.
Yep, so we would recap.
Recap.
Okay, and very good. Do you have any other questions today?
That was very easy. That's fine.
Okay, and we'll set up those other appointments for you at the counter.
Okay,
Alrighty,
thank you. Nice to meet you.